Good afternoon. Thank you for staying for the veterinary portion of our program. Most of you know who I am, Dr. Catherine Loughin, originally from Cleveland. I've been transplanted to Long Island for about 18 years. So I've been working with Dr. Marino. Most of you know Dominic. He is on the seaboard. So we've been doing this Chiari project probably 15, 16 years, however long we've known Dorothy Poppy. So this is just one of the studies that's come out of that project. So I've been sitting in on a lot of the meetings this weekend where there's been a lot of talk about databases, which is something we've done with this project. So we have just been collecting information on not just Cavaliers, but small breed dogs with Chiari this whole time. So we do, for those who've not heard our previous lectures, the study is a full body MRI. So they go through nose to tail, CT scan of their head and neck, thermography, and hearing test. And part of the MRI that we do, we do cine MRI. So for the dogs that have Syringomyelia, they get preoperative and postoperative cine MRI. So there's a lot of data that we have collected, and there's probably close to 400 dogs in that data set. So hopefully as the years go on, we will be giving you more and more information. So I am not the primary author on this paper. It's actually one of my residents who's now a staff doctor, Dr. Jacqueline Holdsworth. She's been working on this project for probably a good 4 or 5 years. Hopefully we'll be getting it published very soon. Of course, Dominic as well. We have Dr. Lesser, who's our statistician, who has been on all our papers, and Joe Sackman, he's been working with us for a long time. He's one of our research assistants. And then Marissa O'Donnell, she's been a more recent addition to our team. I won't go into a lot of detail because most of you have heard our lectures about Chiari malformation in dogs. It is a small breed dog problem. It's not just a Cavalier problem. So someday I will come here with my database on small breed dogs and tell you the difference. But for the most part, if you look at veterinary studies, they're almost all on Cavaliers. They're just the breed that has the most problems. Just a reminder of the presenting signs that you may not see in your human patients. A lot of scratching, especially in the Cavaliers. So sometimes they make contact with their head and neck, but there's a lot of air scratching, so they just feel that tingling sensation and they just scratch at nothing. A lot of them have neck, and I will also say head and thoracic and lumbar pain on their exams, and a lot of cerebellar vestibular dysfunction. So we see a lot of different signs. These are very popular amongst the Cavaliers. We've been talking about a lot of consensus this weekend as well. So not to say that there isn't consensus in the veterinary, because there definitely is not. But during this paper, Jacqueline, Dominic, and I have read a lot of your papers on whether to do a duroplasty or not. So it's been, comforting to know that there's a lot of work that needs to be done on both ends, veterinary and human, to try to get that figured out. So hopefully some of our work will help you with yours. So I'm also very interested in Dr. Limerick's results about the duroplasty or not. So in veterinary medicine, the big controversy that we still haven't gotten over is whether to do surgery or not. So there's neurologists that sit on one side that say surgery is a bunch of hooey and you shouldn't be doing this, you're torturing people's dogs. And then there's us on the other side that say, no, that's not necessarily true. There are going to be dogs that do need surgery to get better. And if you do look at the medicine-based studies, 75% of the dogs get worse. So at least 75% of them probably could benefit from surgery. So we need to come to our own consensus on treatment options as well. So for Dural changes, there wasn't a whole lot written in the literature, either human or in the veterinary world, but we do see osseous compression. When we do our surgeries, we do find there's a very thickened dural band up against the dura mater there as well. So that kind of led us, when we were doing this early on in the study, to find out, well, does this really make a difference in how these dogs do, kind of came up with our hypothesis. So we thought that if we had this Dural band, that we could relate it back to, maybe their age or how long they've had signs, and then kind of relate it all back to how they did, because we do follow up on all our patients after the surgery. So as I was reading many of your papers, there is a significant reduction in syrinxes after doing a duroplasty, and reduction of signs, so that's something that we want to see in our own patients. For us, this is actually our project, our paper that we do, the foramen magnum decompression with cranioplasty, and we do a full thickness directomy, and we send that in for histopath, and we've been doing that for pretty much the entire time we've been doing this project. And then we're monitoring quality of life. So again, you guys are talking about questionnaires. All of our questionnaires go to the owners. So it's kind of like your pediatric patients. You're relying on the parents to tell you what their quality of life is. Same thing with a dog. And they will tell you, this is my child. And they're very, very on top of what's going on with their dog, and how their quality of life is huge, because we have euthanasia. So if you can't improve the dog's quality of life, the dog may lose its life. So it's very important to us. I had to ask Dorothy to help me out getting some of these papers, because they are quite old. So if Dorothy asked you for a paper on my behalf, I thank you as well. So the main paper that we were using actually is this one, Nakamura's paper from 2000, so it's quite long ago. So he found out that Carry 1 patients with Syringomyelia had hyalinosis. They also saw calcification and ossification. They saw that the dura was thickened in chronic conditions. And so their presumption is kind of similar to what we were thinking, that this is a sequela of CSF pressure between the cranial cavity and the spinal cord, and then that increased pressure at the junction would cause pathology in the dura. So that was basically our purpose, was to say, well, we take the dura and we send it out, so let's look at it. Like, what are we seeing, and what can relate it back to? So we started with the simple stuff. Age, how old is the dog? Syringomyelia, whether they had it or not. Duration of clinical signs prior to surgery. So again, you're relying on an owner to tell you when the signs started. So it may not be when the dog felt the signs, it's going to be when the dog was showing signs. And then we also do a quality of life score preoperatively. It's a 1 to 5 score, 1 being poor, 5 being excellent. And then we also gave them a questionnaire after surgery, and several months and years later as part of our cranioplasty project. So we were able to get 139 consecutive client-owned Cavaliers, which in veterinary medicine is a lot of dogs. So we would love to have more dogs, but that's where we're at right now, that we've been able to gather that information. And as I said, they had a whole body MRI before the surgery. We did foramen magnum decompressions with cranioplasties on every single one of them, and they all had the dura resected and submitted for biopsy. And we submitted them all to one pathologist for interpretation. So for those who have not seen our previous lectures, we do a pretty standard foramen magnum decompression. So we take up the suboccipital bone. We actually take the entire C1 lamina off all the way back to C2 and take a little snippet of C2, because in dogs it hangs over a little bit. And I'll show you when we have the plate on why we do that. We also take down the dura, so this is what it looks like after the dura has been taken off. And we actually do go ahead and lift up the cerebellum and look for any adhesions and bales and clear those out as well. We originally started with a different pathologist at Cornell, and then she moved on. So all our specimens were reread by Dr. Miller. He actually has a pathology lab at Cornell. So we wanted to make sure that there was no bias and it was all consistent. This is our cranioplasty. So we do put 5 titanium screws around the opening on the occipital bone, and beneath that polymethyl methacrylate is a titanium mesh, and we use titanium because we do re-MRI all these dogs after surgery. So they get re-MRI'd for free 6 months, 1 year, and 5 years later. They can get re-MRI'd more often if there's a problem, but we want to make sure we can put them through the machine without causing a problem. About halfway through the study, we started putting a fat graft at the very back of the cranioplasty plate. And the reason for that, and this is also the reason we take down a snippet of C2, is because we were finding that some of the dogs were having scar tissue grow back behind the plate and up underneath the plate and causing compression again. So then we had a subset of dogs, about 20%, that had to have surgery again for the scar tissue. We've had one dog, I think, since we put the fat graft in. So we've been able to significantly reduce reoperation rates on these dogs. I am not a pathologist, so I'm not going to go into a lot of detail about the Dura, but just for, purpose of this lecture, we went with the literature to describe the normal Dura. So it's very pretty. This nice little ribbon-like layers of collagen is what your Dura is supposed to look like. The first phase that we found was arachnoid hyperplasia. So you're starting to have some hyperplastic cells fill in where all your little ribbons are. And then fibrosis, there's been more thickening of the layers of the Dura, and it's expanding out as it fills in with connective tissue. Then next, we're starting to get mineralization, so actual bone formation, as well as osseous metaplasia as the final finding that we found. So we put this disclaimer in because we are a clinical, not a research center. And one of the journals was like, you need to have controls, and that's kind of an ethics problem. No normal human being's gonna let their normal dog have their Dura biopsied. And there's even with the university, they can't just take dogs and take the samples without permission. So we ended up not getting any controls, but because there's enough literature out there what a normal Dura is, we use that information for the study. So, as I said, we looked at different variables to see if we could find some connections. So age, sex, so these are dogs, so sex is female, intact, male intact, female spayed, male neutered, that's it, just those four. Duration of clinical signs, again, like I said, based on owner perception, their pre-life quality of life score. Dogs have to be under general anesthesia to have an MRI, so they all have to have preoperative blood work. We documented whether they had Syringomyelia on their MRI, and then of course we took their histopathology at the time of surgery and put that all in a lovely spreadsheet. As I said, we have a quality of life score that they were given. So as I said, 1 is poor, 5 being excellent. So again, we're asking the owners based on their impression of how their dog is doing. We used this questionnaire originally for our first foramen magnum study back in 2007. We are using it currently in the cranioplasty study, which is hopefully going to get published soon as well. We're using it here, so we're going to stick with this particular questionnaire probably for most of our Chiari studies. I am not a statistician either. That's why we hired one. But this is what he was looking at, chi-square tests for associations between the categories, Cruz-Wallace non-parametric test for distribution. We had a very small number of dogs in the arachnoid hyperplasia and the mineralization groups, so he pushed them into the fibrous category and then the mineralization into the osseous metaplasia for his testing. He did a paired t-test and a 95 confidence interval, and anything that was considered statistically significant at less than 0.05. And this is our statistician. So the results, the ages were about 43 months. Most of our dogs in this study are usually ranging between 2 and 13, but most of the dogs having surgery are on the younger side. Pre-surgical clinical signs was about 42 weeks, and they started off at 2.7, which is fair to poor on our scale for quality of life. We had 121 dogs that had Syringomyelia, so we do see a lot of Syringomyelia in dogs as well. Of those 139, only 80% had pathology. That means the rest of them were good. As I said, we rolled the arachnoid hyperplasia dogs into the fibrosis dogs and the 3 mineralization into the osseous metaplasia. We did see changes in dogs as early as 4 weeks of clinical signs. So as I said, that's kind of dependent on owner perception of signs, but that's pretty early for a dog. And at the time of decompression, the presence of Syringomyelia, what their quality of life was before, did not have any association with the histopath changes, so that was a little disappointing. But more than half of our specimens did have pathology present. And it's interesting that it was only after 4 weeks, but as I said, it may be that these dogs had clinical signs longer. There was no association with how old the dog was, if they had Syringomyelia or not, or if their pre-op score was really low. So it's unsure at this time the influence that these histologic changes have on long-term prognosis. As I said, we do follow these dogs out. We have dogs that are 10, 12 years out. They do die, usually in their teens, so at some point they do tend to pass away from other things. Heart disease, number 1, probably in the Cavalier. So the good news is most of them have not passed away from their Chiari. We can't really comment on about whether you should do a duroplasty in veterinary medicine. We're pretty much the only ones doing cranioplasty. Some people just do a foramen and magnum decompression and that's it. There's other people who do duroplasty. There's another group that does fat grafts. And it's not a lot of dogs. So it's hard to compare studies because it's not the same. And some of them do add in the non-Cavalier, so that adds another factor into it. Before I go into any questions, I am going to shamelessly promote my walk. So I'm on the board of directors. I'm also the treasurer, and somehow I volunteered to host a walk this year. So if you're in Long Island next Sunday, we are having a walk at West Hills County Park, and it's to benefit not only the Bobby Jones CSF Foundation, but also the New York Veterinary Foundation. So what the New York Veterinary Foundation does is it helps fund this Chiari project. So in the beginning, Dr. Marino has funded this project on his own, out of the kindness of his heart. Now this foundation institutes some money, and it also helps with service dogs. So especially dogs who've been in the military or for the police, when they retire, they don't get benefits anymore. And so their care, sorry, Caitlin. So then the officer or whoever adopts the dog is responsible for their care. So we can help defer some of those costs. And also, this is a rendering of what the hospital is supposed to be looking like in the near future. And part of this new project that Dr. Marino has is a new lecture amphitheater. It's going to have 100 seats. And he does do a lot of lectures for the police and Army. We have a lot of the Army guys come in. They have to learn how to treat the dogs that go out with them. They don't always have veterinarians, so a lot of like the EMTs and stuff, they have to have training on how to like bandage dogs and putting catheters and stuff, so we provide a lot of that training for them. So in this new hospital, maybe we will hold a Chiari lecture for you as well. So do you have any questions? Yes, right here. Go ahead.
Is it possible that inflammatory changes in the dura could be precipitating some of the neurological things that are treated? For instance, 20 years ago, I looked at some childlike cysts, and we found a lot of inflammation in the perineural, the perinurium, what should normally just be thin, normal dura or fibrous tissue was inflamed. And also, Ann Maitland's work has shown that these mast cells, the primitive immune system, which is ubiquitous, can induce inflammatory change. And we haven't in the past really been looking at them, but there are stains that will pick up the mast cells very well. I was wondering if you'd seen any of those.
No, we haven't specifically looked at that, but that's something that could be another step, because as I said, we have a database. So the one thing we could go back and look at, because we didn't in this study, is the clinical signs. Is it specific to the specific signs too? As far as restaining the samples, we'd probably have to do a new project, because all those samples some of those samples are really old. So, but I mean, that'd be something to look at in the future, is staining for like mast cells. Yeah.
Address your reviewer's critique about not having control dural specimens. Would it be possible to get control posterior fossa dura, not just any old dura? You need to get the same.
Right, and that was the problem.
Autopsy specimen.
Yeah, so we did. We tried. We spent a year trying to get those from Cornell, and they only had like 1 or 2. As I said, there is some legality associated with getting samples from pet-owned animals. So had they been like, somebody had euthanized a bunch of research dogs, then it would probably have been very easy, but during that year that we tried, it didn't work out.
So if you don't mind asking, what was their quality of life score after the surgery?
4. Yeah. So much, much better. Yes?
Do you have any incidental Chiari in dogs? I mean, like some dog gets decided to do the MRI scan.
Yes, all the time.
Because I just thought that, I mean, the question is, it looks like there's some developmental component, as Fraser was talking about, but the assumption is a congenital lesion. But I mean, it'd be sort of interesting to follow like when the condition really manifested itself completely.
Well, I do have a puppy study, because I had, in the very beginning, we were doing a lot of breeder dogs, so I actually do have some MRIs on puppies. There's only like maybe 20 dogs in the study. It's one of the things I need to get back to, but usually they will progress during the first 2 years of their life. So like when we were very early working on this with Claire Rusbridge in London, she's doing more of the genetic side of it, but we put the cutoff at 2.5 years. So if you had a breeding dog that you MRI'd before 2.5 years old, you couldn't certify them as an A grade dog until they had another MRI after 2.5 years, because sometimes they'll just have like a very mild malformation and no syrinx, and then after 2.5, it'll get worse.
So it gets worse with time?
It does get worse with time, yeah.
Okay.
I think they've dropped that potentially to a year because
Yeah.
it's starting to present earlier, but then that raises the question too, if we image too early, you can't clear a breeding dog. Because
Yeah, they're never going to be able to clear a breeding dog on MRI alone. They're going to have to, they're doing genetics.
That really doesn't happen to people. If you have a Chiari, it doesn't change much.
Certainly doesn't change whether you're allowed to breed or not.
Yeah.
There's no breeding requirements.
Yeah.
Sometimes for the
Yeah, so I mean, it's all changing. But as I always tell, I never tell a breeder, I give them recommendations. I never tell them whether they should breed their dog or not, but they're going to find, just like with people, they're going to find the genetic marker. And that's the only way they're going to get most of these diseases out of dogs, because a lot of these don't manifest until they're over. Like the Cavaliers have mitral valve dysplasia, and it doesn't manifest till they're 8 or 9 years old. So if you're certifying a breeding dog that his heart's great, well, when it's 8 years old, it might have heart disease, and they die of that. That's very progressive in a lot of dogs. So, I mean, I think genetics is the way to go, and if you're going to breed dogs.
Cormac could probably comment better because he's the natural history study guy, but I mean, I have a number of kids who had an MRI when they were 1 or 2 who didn't have a Chiari, who then had, that's how I always say, I think it's more of a developmental issue. I think you can actually look at the skull, like on the skull base, and when they're younger it's coming out this way, and when they're older.
Yeah.
I just saw a kid that I was going to operate on that it had been a year, so we said to get another MRI, and it was the opposite effect. His Chiari effectively went away from 2 to 3 years of age, just based on how the skull.
And we typically don't.
No, but in the really young kids, I think it can change.
Yeah, and we typically don't do surgery if they're less than a year. We've only done 1 or 2, and it's only because the dogs were so bad. And the one that we did, he's actually still alive, but he had to have a second surgery, and he almost died during that surgery. He was on the ventilator for days, and then he was in the hospital for months. So he's doing okay, but he was a very, very severe case. So we try to wait till they're older, but just so, again, so their skulls stop growing.
Thank you very much.